Clinical research is too competitive to be worried about how much money you're making, whether you're going to be able to get that dream job you want immediately if you have no experience. Hey guys, ECRG here. Today we're going to be talking about why you need to take the first job you're offered in clinical research. And this is a really juicy one, maybe even a little bit controversial, but clinical research has gotten way too competitive. It has gotten crazy competitive. It has gotten even more competitive than when I first came in. 2016 was my first year in the industry. And, I started in the middle of 2016. And everyone that I had known before that, 2015, 2014, the industry has always been very healthy. It's always been, very lucrative for individuals, but it wasn't as popular as it is now with the internet and people starting to finally figure it out. See, I went to university in one of the hubs of clinical research. And even then, I went to a large university. Even then, not many people knew about it. And it was never really talked about at school and everything about what you could do in the clinical research industry. Even with some of the stalwarts of the in clinical research industry, being just nearby. So it's way more competitive than when your mom was in the clinical research industry. It's way more competitive than your mom's and dad's clinical research. This is not the same time. And the industry is going to be even booming 2018, 2019, 2020 is predicted to grow year over year. Even then, especially with clinical trials becoming even more global. It already is global, but they're going to be running trials in every countries all over the world. And so they're really looking to grow, and, more money's coming in from the sponsors to run these clinical trials. So, and it's getting more and more competitive, guys. I remember I first got my start in this industry as a contractor, barely making any money. And, for the jobs, they really want you to see experience. So if you're given a permanent job, good benefits, decent salary, don't fret about the salary too much. Now, obviously everyone has their different situations or whatever, but you really just want to do your best to get some experience under your belt, whether it's a year, 6 months. Keep your eyes open for what you can find elsewhere and, take that. But you really just want to get in, take that first job, no matter what it is, whether it's a contract, whether it's a internship or a shadowing opportunity, volunteering opportunity. Get in, get experience, do your best, work hard, get those relationships, get those business cards, get those business connects. And that will help you in the future when you want to make a bigger jump, make a little bit more money. That will definitely help you. But I see a lot of you guys, I get a lot of emails from you guys talking about how fancy you want to be. Don't get fancy, guys, just because they're only paying you, $10, $15, $18 an hour. Yeah, you'll make a lot more later on, but don't think that you deserve that now with no experience. And definitely don't think because, you majored in biology in college or whatever, you know how to be a clinical researcher. Or even if you have a master's degree or a PhD or whatever, dude, that don't mean nothing. That does not mean you know how to do the job. So a lot of people come in and act all big and bad with their fancy degrees or whatever, but that doesn't mean anything. You don't know how to do the job still. So don't think the job is beneath you because you still don't know how to do the job just because you have some letters behind your name. So a lot of people are trying to be too fancy. You just want to get your foot in the door, and kind of get in where you fit in. And, I find a lot of the foreigners, people that grew up India, Caribbean, elsewhere, they're not as fancy. They understand. They just want to get the experience so they can get on to do what they want to do, whether it's a CRA or a project manager or a project director or whatever it is. But a lot of the Americans that email me with their graduate degrees and stuff really think that they can go, be a project manager without any experience. And that's just not going to happen. They're not going to put you in charge of running a, $20 million clinical trial with no experience and a fancy degree. So that's just not going to happen. Stop being fancy, take the first job, get your experience, and you'll be a lot better for it. With the years of experience, you'll be able to get another job elsewhere or within the same company that may pay you a little bit more. So, a lot of people are getting hung up on the money, and I understand you got to live, you got to pay your bills, you got to pay your student loans. So you've got to, do what you can and maybe hold off for a little bit longer. But I find that the people that do take that first job, the contract position, whatever it is, only for a few months, they end up further in where they want to be faster than people that wait months for that perfect job, that quote unquote perfect first job. And there really is no quote unquote perfect first job. Just get that experience. Trust me, you'll be much better for it. Just get in, get that experience, and you'll be a lot happier. So guys, as always, email us at eliteclinicalgroup@gmail.com. We respond to everybody there. I read a lot of those emails. So email us there at eliteclinicalgroup@gmail.com. Any inquiries you may have, you want to get your resume reviewed for clinical research, we offer that program as well. You want to advertise with us, we offer that as well too. Email us there. And comment down below what your first job was in clinical research. How did you get your start? So put that in the comments, guys. All right, guys, take care.